In today's society, Americans are developing an unprecedented increase in bad eating habits, many of which constrain from understanding what it truly means to have a healthy eating diet, and the results can be irreversible. Sadly, many Americans don't know that they are diagnosed with diabetes solely because they are misinformed. Bad habits can lead to diabetes, heart disease, stroke, and much more disastrous health disease that could endanger one's life. In importance, we're only going to be talking about the fundamentals of diabetes, or most commonly known as type 2 diabetes, type 1 diabetes, and prediabetes. One of the easiest ways in preventing diabetes is through exercising. Sadly, many miss this opportunity, thinking that exercising is tiring and unenjoyable. However, in my experience, as a volunteer in a triathlon, I discovered the importance of exercising. Looking around at the triathletes, I noticed that most of them had healthy looking bodies and were highly spirited. Exercise is important not only for physical health, but mental health as well, and regularly exercising can increase your mood and happy hormones. If Americans continue to unregulate their poor diets, diabetes can become a growing national pandemic. Be that as it may, there are several solutions to prevent or retrogress the physical and mental attributes of diabetes. According to the Internet article, more than 100 million Americans have diabetes or prediabetes, illustrates that in 2015, 30.3 million Americans have been diagnosed with diabetes. In addition, another 84.1 million have prediabetes, a condition in which, if left untreated, would often result in type 2 diabetes within 5 years. In this article depicts an estimation of the age-adjusted prevalence of diagnosed diabetes by race, ethnicity, and sex amongst adults ages 18 or more in the United States at the time period of 2013 to 2015. The article stated that over 100 million US adults are living with diabetes or prediabetes, according to a new report released by the Centers for Disease Control and Prevention. The article also states that diabetes is a serious disease that can often be managed through physical activity, diet, and the appropriate use of insulin and other medications to control blood sugar levels. Because of a spike in blood sugar levels, people with diabetes are at increased risk of serious health complications including premature death, vision loss, heart disease, stroke, kidney failure, and amputation of toes, feet, or legs. With such a growing problem, many have sought for solutions to prevent this pandemic. Although diabetes is a prominent disease, there are several ways for diabetes to be treated, such as weight control. In another internet article, How to Prevent Diabetes, highlights the solutions to prevent or delay type 2 diabetes. In summary, many Americans are at a risk of getting diabetes type 1 or type 2. However, there are many solutions such that losing weight and keeping your weight under control is crucial to preventing diabetes. By reducing your overall body fat, can prevent a heart stroke, high blood pressure, and cancer. Furthermore, by losing 5 to 10% of your body fat may delay and prevent diabetes, and it is imperative to not gain them back. Another solution would be to create and follow a healthy eating plan. Reducing how much calories you eat and drink will help you lose weight. Not only does diabetes affect Americans, but other nations as well. According to the article Curbing the Diabetes Pandemic, the Need for Global Policy Solutions, Hugh explains that the growing pandemic of diabetes poses an enormous public health challenge for almost every country across the globe. Her analysis proved that more than 380 million people were living with diabetes worldwide since 2014. She expects that the number will rise to 592 million by 2035. Furthermore, lower socioeconomic groups are more prone to diabetes as 77% of the world's diabetic population exists in low and middle income countries. She states that it is also no longer predominantly a disease of the old. Almost half of the people with diabetes are in the range of 40 to 59 years of age. Not only does this article prove that diabetes affect the elderly, but the youth as well. A problem to diabetes is that many Americans are unaware that they have symptoms of diabetes. In the article, Early Symptoms of Diabetes, Dan Singer says that in order to understand if someone has diabetes, it is shown by having early symptoms such that higher than normal levels of glucose, a kind of sugar, are inside your blood. Dan Singer also states that the symptoms of diabetes correlate with dry mouth and itchy skin, blurred vision, peeing more often, and being thirstier. In addition, if not enough insulin is emitted, then the glucose blood level remains high. Dansinger argues how imperative it is to talk to your doctor to get tested. By spotting the condition early, you can avoid nerve damage, heart trouble, and other complications. Furthermore, talking to your doctor openly and honestly can help him or her with their work The problem with patients is that they ignore the symptoms and they don't confront their doctor about them. Many Americans are uninformed with the cause of diabetes and how it could be treatable. According to the article, The Real Cause of Diabetes explains how diabetes is caused and the steps to prevent them from happening. Malinow states, diabetes is a disease caused by excess insulin, not excess blood sugar. Malinow concludes that diabetes is not the result of glucose intake but influx of insulin production in the body. In other words, high blood sugar is a symptom instead of being the root cause. Insulins are responsible for reducing blood sugar. Malinow says in order for insulin to work, our tissues have to be sensitive to its action. Otherwise, tissues become resistant and insulin struggles to clear out sugar from the blood. This is mainly caused by our diet or the food we choose to put into our body. In addition, after eating carbohydrates, the carbs are then broken down to sugar, triggering the pancreas to produce insulin and are then stored in the liver and muscles. There is a limit to how much your liver and muscles can store, so once they cannot carry anymore, the excess sugar is then carried out by the insulin to the liver and muscles into fat cells and stored as fat cells. Many do not blame the poor eating habits as the reason for diabetes and instead blame the food industry for hidden sugars. They claim that the food industry puts too much sugars into their products so that the consumers will stay addicted. According to the article, Five Clues You Are Addicted to Sugar depicts that there are 600,000 processed foods in the marketplace, 80% of which have added hidden sugar. The average American consumes 22 teaspoons of sugar a day, mostly hidden, and the average teenage boy has 34 teaspoons a day, which are more than two 20-ounce sodas. However, the consumers need to be more informed about the products they choose and learn what constitutes a healthy diet. For instance, restrict oneself from eating fast food restaurants which contain highly processed foods and sugars. Instead, they should try to gather organic ingredients and cook it at home and avoid ready-made foods. All in all, although diabetes is a prominent problem, it is easily treatable with proper diet changes and physical activity. A simple activity such as walking 30 minutes a day can be enough to battle diabetes. Hopefully, by informing more people about the effects of diabetes, they can learn to take care of their lives. With this new information, let's bring an end to diabetes and continue a healthy living.